Do you really have high blood pressure? Hi, I'm Dr. Kuehne. I'm a primary care physician, and I see this all the time, that people are on medications without really having a need for it. Now, many times these medications are justified. Millions of Americans are currently on blood pressure medications, but in many cases, this might not be warranted. It comes down to three things. Number one, what parameters are we looking at to put someone on a blood pressure medication? Number two, how do we measure the blood pressure and under what circumstances do we measure it? And then number three, do we do the appropriate follow-up, right? And so, first of all, about the parameters, this is something a bit controversial. So, if you go by the old standards of the American Academy of Family Physicians, for example, they used to say anybody under 140 over 90 really doesn't qualify for blood pressure medication. Yeah, we want to get kind of off that a bit, but we don't want to do drastic measures here, some lifestyle changes and so on, which I would agree with. And I think that's absolutely fine. Now, the American Heart Association is pushing more for 120 over 80, which is, of course, a big difference. And this difference between the guidelines could mean that many people are going to be started on medications to get to the lower value that we're trying to achieve. And this might be a bit misguided, right? Now, I think that the old guidelines of 140 over 90 were absolutely fine. We want to make sure we catch those people that are really drifting way above that. That's something that is, of course, concerning. But it used to also be that we said, hey, listen, let's do some lifestyle changes first, because we know that one of the underlying causes of high blood pressure is insulin resistance, for example. So can we improve the diet of the person? Can we help them lose visceral fat? Can we do all these things? A lot of times in the primary care setting, people are overwhelmed. There's not much time for counseling. And then the guidelines usually are that we receive the medical school. Well, they're not going to do it anyway. So just talk to them a couple of times and put them on a medication. I think, again, that's misguided. It's much better to prevent. It's much better to treat naturally than jumping on the medication. But that's just, my personal opinion here. So, of course, this is one thing. What guidelines does your physician adhere to? And you can read this up, and then you can even say, hey, listen, what is my goal here really, right? And is this realistic? And can we do other things first? So that's number one. Number two is, how do we measure the blood pressure? And of course, there can be mistakes made there as well. If you rush into the office, you've just been sitting in traffic, your blood pressure will be a bit higher. There's some white coat hypertension usually. If you have any issues with stress, these are certainly contributing. And then also, ideally, we will put you in a room that's quiet and with the optimal climate for about 10 minutes to calm down. And then we take the pressure. That never happens. So you get rushed in, you're sitting probably in an awkward position. Someone slaps the blood pressure cuff on you and measures your blood pressure. And this is not very precise. The other thing is you might be sitting there with a full bladder. You didn't have time to pee before. And that's actually another thing that can drive up your blood pressure. These are all things that should be avoided. You should go to the bathroom before you take your blood pressure. You should be calm. You should be sitting down, both feet on the ground. You should have your arm about the level of your heart. And again, it should be under circumstances where you're relaxed. So if you just did homework with your kids or you argued with your spouse, that's not a good time to measure your blood pressure, actually. So I always recommend to buy your own blood pressure cuff and check your pressure at home as well. And ideally in the situations where you're a bit more relaxed. And you can do this at different points in the day to get a better idea of where your blood pressure really is. And again, even at home, you should have the right parameters to check your blood pressure. That means it should be a calm situation. You didn't just have an argument with your spouse or did homework with your kids. So you're calm, you're relaxed, you have both feet on the ground, you just went to the bathroom, so you don't have a full bladder, and then arm about the level of your heart, and then measure your blood pressure a couple of times. And you can do it at different points in the day. That is a much better value to see really where your blood pressure is, because those are the optimal conditions that you should check it under, right? That's the second thing. And again, if this is not done correctly and if it's only high in the physician's office, then document these values that you get at home and talk to your physician about this. That's actually very valuable information here, right? And then the other thing is the follow-up, and that's often missing as well. So let's say you had someone who was slightly obese, who had a high blood pressure. Maybe the medication was justified. They were 165 over 100, and we had some concerns. Absolutely, not a question. Now, if this person now gets healthier, they go to the gym, they lose weight, they lose a lot of visceral fat, they're eating healthier, they have better sleep, they're less stressed out, they're making positive changes in their life. We have to check them again, because the other thing is, once you get a script for medication in America, good luck getting rid of that, because they're just going to keep filling that medication for you without very good checkups, right? So if you're getting healthier, talk to your doctor. Hey, I made some changes. I would like to reevaluate if I still need this medication or this dose of this medication. Of course, don't make changes on your own. You should always be transparent with your physician. But the idea should always be the less medication, the better. And of course, this goes absolutely against the pharmaceutical industry. They would like you to be on medications in perpetuity, which is, of course, not a good thing for you. So these are the three things that I would look at. Really evaluate if we need the blood pressure medications. I think there is a big number of people running around on blood pressure medications where it's not justified. There's, of course, also a population where it is justified, but we really have to figure out which is which, and we should do it on the right parameters. And our goal should always be to minimize the medications that we're using.